I'd like one health record to go, please. This may sound like a crazy notion to most patients, since before records went electronic, patients didn't have much access to their own paper charts. However, as technology progresses and offices continue to go electronic, patients will have easier access to their records and will be more involved in their own health care. Middlefield Clinic, an independent family practice in the Amish countryside east of Cleveland, shares with the Ohio Health Information Partnership the benefits clinicians have seen for patients since the clinic went electronic. The #1 benefit is ePrescribing, says solo practitioner Dr. John Floriano.
The patients are flabbergasted that I can be talking to them in the room, and with the click of a button, their script is already at the pharmacy. They don't really understand it many times, but they're amazed that technology has allowed us to do this. And for us, it relieves a lot of the hassle factor with pulling out a script pad, writing the script, and it's also a good documentation of when they got what drug, how much they got, when they're due for a refill. It's a tremendous record keeping for that patient, and it helps. And there's no question that when it gets to the pharmacist, what the drug is, what the dose is, what the frequency is, etc. So we've eliminated the handwriting problem.
With their prescription already sent to the pharmacy, patients can learn more about the drug they are taking and information about their specific condition through a printout summary of the day's visit through Dr. Floriano's electronic record.
Yeah, at the end of their visit, they get a summary that says, okay, we addressed these issues, this is our recommendation, we'd like to see you in blah, 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 blah. And then usually they give them, some kind of literature that will, about what they had going on. And patients love it. I mean, they can, especially the elderly patients, because they forget. They leave here and then they call the next day and they say, when am I supposed to come back? I don't remember what medication I'm supposed to be taking. So when they have that paper, they can take that home and they can reference that, so that they know their instructions, they know when they're supposed to come back, they know what's wrong with them, they leave knowing what's going on with their own health care.
These summaries of a day's visit are especially helpful to older patients or people taking many prescriptions. A summary helps clarify how they're doing with a certain condition or why their medication has been changed. It also helps to give the correct, accurate information to caregivers in the family.
One of the challenges is when you treat older patients, a lot of times they're on 20 or 30 medications. Mm-hmm. And so if we make a small change in something that they're taking, or we eliminate something that they're taking, we can verbalize that to them, but there's a pretty good chance they're never going to remember that. And the ability to produce a document for them before they leave the building that gives them specific instructions about what we addressed today, how we change things, what things are staying the same, is tremendously helpful for them because it's in black and white.
That siren is a sound no one wants to hear. When it comes down to it, one of the biggest benefits to patients is the fact that doctors have access to their records when and where they need it, such as if a patient is admitted to the hospital or to the emergency room.
Our electronic medical record allows us to access on my iPhone my patient charts, so that if I'm in the hospital seeing a patient and I want to look at their record, I can pull out my iPhone, go through the secure portal that our electronic medical record provides, and I can look at all their history. I can look at all their notes, their labs, everything.
If you're a patient and want more information on electronic health records, or if you're a doctor or clinician and want to know more ways to improve patient care, please visit www.clinisync.org.